Hello, dear listeners. Welcome to another episode of Follow Your Path. My name is Abdul Abid. I'm a surgical pathology fellow at UPMC in Pittsburgh, and today we will be talking to Dr. Bobbi Pritt. She is a professor of pathology at Mayo Clinic in Minnesota, and she is also the division director for clinical microbiology. I am joined today by a future pathologist, Casey Shuko. Welcome to the show, Dr. Pritt.
Well, thank you. It's great to be here.
Wonderful. To start off, can you tell us a little about yourself, where you grew up, where you went to medical school, where you did your residency, and how did you end up having a career in medical microbiology?
Yeah, sure. I'd be happy to. I grew up in Vermont and upstate New York, so I was definitely an East Coast person. Um, Went to medical school at the University of Vermont and then stayed there for residency. It was an awesome program, still is. Did I was the last of the 5 year group where you had to do the 5 years, where the fifth year was kind of like a mini fellowship. Um, and then went to Mayo Clinic to do a microbiology fellowship, a true microbiology fellowship. And that was what brought me to the Midwest. I had never really been to the Midwest before. I went into pathology like many people because I am very visually oriented. I loved looking at things under the microscope. I also like working with my hands. So I thought autopsies were kind of fascinating. And so I was really leaning more towards anatomic pathology when I went into pathology as a residency. But I learned about halfway through, which for me was in my third year. I had the luxury of a little bit more time than people these days. Um, that looking at the workflow and looking at what my attendings were doing, I actually thought that a clinical pathology career might be better suited for me than anatomic pathology. And I don't want to, you know, turn anyone away from surgical pathology. It's a great specialty, and I actually still do some surg path, which I'll tell you about a little bit. But I realized that I didn't want to sit still all day long and sit at a microscope and look at slide after slide after slide. I liked having more variety in my day. And I realized that surgical pathologists are mostly at their microscope. They're teaching, they're going and doing a few things, but it's a lot of microscopy work. And unless they're in a small practice, they're probably not the ones grossing. Which, to me, I really like the grossing. I like seeing the tissue. I probably wouldn't be doing that in my future practice. Also, I realized I probably wasn't going to be doing autopsies, maybe a little, but those numbers are going down nationwide. Mayo Clinic in Minnesota is one of the few places that has really high numbers still. All of our residents get about 100 cases in each, no shared cases. So our numbers are pretty high. But I realized that I probably wouldn't be doing autopsies as an attending unless I went into forensic medicine, which I realized probably wasn't what I wanted to do. So that kind of left me thinking, what kind of workflow do I like? And I like doing different things every day, even every hour. I mean, it's nice to have time as downtime to decompress as well, but it's fun to do a little research, do clinical care, do teaching, and have it all interspersed throughout the day. And I really liked microbiology. So I thought, well, hey, that works out pretty well. And I had a few mentors along the way that were just really important. Having great mentors is just such an essential part of pathology. And we all like to mentor and teach. And so I've been hopefully paying it back. But my two big mentors that were in surgical pathology weren't quite sure that I should go into microbiology at first, but I think they came around and realized that it was a really good career for me. And then I had a microbiology mentor, Dr. Washington Wynn, who was amazing, and he just really helped foster my growth in that area. So that's how I ended up in microbiology. After I did my fellowship at Mayo Clinic, I was hired on, and I've been here ever since.
Man, that's a wonderful introduction and story that you bring. I was going to ask if there was any particular faculty member or mentor that kind of inspired you, but you kind of answered that. So I'm actually going to jump to the next question, if
Okay.
that's okay, which is for Dr. Pritt. In your opinion, what makes microbiology unique?
Yeah, that's a great question because, yes, it's a branch of clinical pathology and laboratory medicine, but it's a little different than chemistry or, coagulation. And that's because we're studying living things. And every organism is diverse. They're little life forms. Some of them are actually very complex life forms. I specialize in parasites and vector-borne diseases. So these little parasites are little animals with complex life cycles. To study them, you almost need to be a zoologist, like a veterinary pathologist, because you're studying these little animals. So that makes it cool. You're not just studying the human host, you're studying animals and organisms that have completely different genetics, 16S ribosomal rRNA instead of 18S, like, eukaryotes have. So that makes it very different. Another thing is that infections can very quickly kill someone. So there adds that urgency. Also, infections, as we have seen over the past several years, it's yeah, they come out of nowhere. They cause pandemics, epidemics. We have emerging drug resistance. If you're a microbiologist, you're going to have good job security. They're basically estimating that every 3 to 5 years, there's going to be new organisms, new outbreaks, recurrence of old foes like tuberculosis, but with drug resistance. So that's another thing that makes microbiology interesting. It keeps you on your feet. Is you have to stay on top of the science, and there's always new things to learn.
Oh wow. Yeah, I mean, I feel like, especially in these days, like if we were talking, maybe even in 2019, it was not quaint, but now it's much more urgent for the need for
Mhm.
microbiologists in the U.S. and across the world.
Yeah,
I just want to jump on one of the questions previously. So you mentioned some of your mentors. Can you tell us, like, what what were some of their best practices that you
mm.
learned from them, and can you have used in your own practice and other people can use?
Yeah. Well, I had three mentors that I'll mention. I actually had many, many mentors, but Abdel El Hosseini at the University of Vermont, he was great. He would always, whenever I saw him, he wanted to chat, sit down in his office, and he would take classes to advance his knowledge, like leadership classes, and then he'd sit down with me and tell me what he learned. Or he'd run into like these ethical conundrums and he'd pose them to me and ask me what I thought. So he challenged me to think. Another mentor was Dr. Kumare Singh Cooper, who was a surgical pathologist, as was Dr. El Hassini, and also a cytopathologist. And Dr. Cooper was a fabulous teacher, still is a fabulous teacher. And he used to do Cooper rounds where we'd all sit down at a multi headed microscope. And he just loved teaching. He loved what he did. He had just a sense of fun and joy about what we did as pathologists, and he just had a great memory and he loved going up to the whiteboard and coming up with lists like what are all the things that can cause brown pigment in tissue, hemosiderin, malaria pigment, etc. um, and I really learned a lot from his teaching style. My third big mentor at the University of Vermont was Dr. Washington Wynn. He was the microbiologist. He unfortunately passed many years ago, but was a very just such a character, and he was a microbiologist that went the clinical pathology route, and just really knew a lot and did a lot with the College of American Pathologists, and ended up writing a letter for me to help me get onto the microbiology committee for the CAP. And I'll mention that that's an excellent opportunity for anyone who residents and maybe even med students start thinking about this, getting involved in your professional societies, especially CAP. Just such a valuable experience. The people I met then really had a major impact on me later in my career. So each of my mentors had some different contributions. They're all wonderful. And there's many other people I haven't mentioned that were also excellent mentors.
Mhm.
And so I think, that's the thing I would say for pathology residents and med students listening to this, kind of seek out people that share interests with you and develop that relationship with them. Those are going to be really important relationships that you'll want to forge and nurture over the years.
Oh wow. Yeah, so now I get to the regular question that I wanted to ask you. So
Okay.
can you share one or two interesting cases that you have seen in your career that have stayed on with you all through these years?
Yeah, definitely. There's so many cases. Being at Mayo Clinic, we're an international reference lab. And then, of course, people come from all around the world to come here. So many, many cases that I've seen that have made an impact. But I'll mention one that was really fascinating that I got to play a large role in. And it was a case that we published on. So a lot of this information is out in the literature. But it was a little boy who presented with a fever of unknown origin. And um, we performed every test we could think of on this little boy. And it was during the summertime. And so they were suspecting it could be a vector borne disease, tick or mosquito borne. And so we did a test. It was actually a PCR test for Lyme disease, which usually isn't part of your regular testing for Lyme disease. But because we're this, reference lab, we have a lot of these more advanced and esoteric tests. And it ended up detecting a novel species of Borrelia. Normally, Lyme disease is caused by Borrelia burgdorferi in the United States, but this gave a positive result, but it was not typical. And it turned out with additional sequencing, it ended up being a brand new species. We called it Borrelia mayonii after the Mayo brothers that founded Mayo Clinic. And it's now the second known cause of Lyme disease in the United States. It's thankfully just in the upper Midwest, so not widespread. And it allowed us to treat this little boy with doxycycline, and he made a full recovery and is doing really well. And we've since detected multiple other cases. So that's kind of a cool example of how we as pathologists help develop tests that have an impact on clinical care. We work directly as part of the patient care team because we're clinicians too. We're taking care of patients, even if we don't see them in person. And we're then, if we're motivated, which I highly was, and most pathologists are really, engaged with the science, you ask those questions and like what's causing this, what is this exactly, and that allowed us to figure out it was a new organism. And then of course we published our findings so others would benefit from that knowledge as well.
And that's an amazing case and story, Dr. Pritt. I could definitely tell throughout this interview, I think your love and passion for microbiology, which is definitely inspiring for a future pathologist like myself. And I know for all the other trainees that are and will be listening to this podcast when it comes out. I think of all the wonderful things that you've talked and shared about microbiology. Can you pick like a most gratifying aspect of your job?
Well, it's probably the patient care aspect, and I'll tie into that working with people because I work with an amazing team. And at Mayo and healthcare in general, it's very much team based. We've all recognized no one person can do everything. And so, whether I'm seeing the patient directly or not, I'm still part of that patient care team. And pathologists are an essential part of that patient care team. We're usually giving the answer of what the person has so that the patient can be treated. And that whole interaction, being able to go home and know that I've helped someone, and in some situations know that I've really made an impact, like they didn't even know what it was and I was able to make a diagnosis. I mean, that's really gratifying to know that I could help people like that.
Definitely. As someone who was a former, student athlete myself all the way through college playing football, I'm a huge believer in the aspect of team. And I think especially in medicine, and I think especially in pathology, that reigns true. So thank you so much for sharing.
Yeah.
Yeah, my pleasure.
So, Dr. Britt, for anyone who is interested in pursuing a career in medical microbiology as a resident, what is the pathway? Like, what kind of fellowship do you have to do? Are there board exams and stuff?
There is a fellowship and there is a board exam. So after you complete your pathology residency, which could be APCP or just CP, um, you would then do a 1 year fellowship at an ACGME accredited site. And I believe that includes Canadian graduates of ACGME accredited pathology programs as well. And after that 1 year, you are fellowship trained and you can sit for the medical microbiology boards through the American Board of Pathology. So actually, I'm really glad you mentioned that because we are currently recruiting for our 2024 fellowship position for medical microbiology. So if any residents are listening and are interested, please give me a call. Yeah.
Awesome. All right. I think that kind of brings us to our final question here. What advice do you have for residents who are interested or maybe interested in this specialty?
Well, definitely, yeah, so it's a great question, Casey. Definitely finding out everything you can about it, spending time in the microbiology lab and with medical microbiologists. But again, going back to that advice I gave earlier, keeping in mind that you want to be looking at what your attendings are doing. As a medical microbiologist, you're not going to be the one on the benches working up the specimens. So, don't get caught up in that if you think that that's maybe not interesting to sit at a bench and work up organisms. Now, that's a great job, but that's a different job than what a pathologist does in microbiology. So, finding out what are your medical microbiologists doing? What is their day like? I tell my residents to and medical students do little educational interviews. If anyone asks me, can I sit down with you over coffee and spend some time learning about what you do? I mean, I've never said no to that. No one says no to that. We all, if we love what we're doing, we want to talk about it and help, recruit the next generation. So I would say talk to the people that you think have cool looking jobs and then ask them what they like about their job, what they don't like, what their typical day is like. So if you're interested in microbiology specifically, I'd be happy to talk to anyone who is. And then, getting that experience in the micro lab, but this applies to all specialties across pathology.
Oh, wonderful. I just have one last supplementary question. I I know a lot of, and this is something that I'm sure that once you become a resident, you see that many people who are in medical microbiology are coming from the PhD route, while you are going from the MD route. And I know other people who, one of my co-residents is, he is still doing fellowship. He went from the MD route. So, is there a particular difference in the training or experience? And if you could elaborate a little bit on that.
Yeah, I'm really glad that you asked that, Abdul, because this actually ties into something I wanted to mention, which is our role as pathologists. So it is true. You can get into medical microbiology and be a lab director and essentially do what I do, with a few exceptions, in three different routes. So you can be a pathologist like me and do the medical microbiology fellowship. Honestly, you could become a microbiologist without the fellowship, although today in large academic centers, almost everyone's fellowship trained. So that's route number one, pathology. Route number two is infectious disease training. You could actually do your internal medicine and then do internal infectious disease resident or fellowship, and then do that same 1 year fellowship that pathologists do. Take your boards, be a lab director. They're both great. They both bring different things to the field. In my lab, we're quite large. We have 8 of us that are uh, lab directors, medical directors in medical microbiology. 2 of us are MD infectious disease, and 3 of us are pathologists. The rest in my group are PhDs. That is route number three. And that is where someone who really just loves microbiology, maybe they're not really interested in other aspects of pathology in medical school for that matter, can go and do a PhD in something in microbiology and then do a 2 year fellowship in microbiology rather than one. And it's a different fellowship, different boards, different accrediting body. And then they can also become a lab director of a medical microbiology lab. The salary is different, it's typically lower. They can't serve as a billing provider, so they can't have their name on medical reports, for example. And obviously, they can't sign out slides and bill for CPT codes. Um, and it depends on where they are, whether they have the same responsibilities or not. In my lab, my colleagues, we all get treated the same, but that's not always the case everywhere. So, of those three paths, what makes a pathologist unique? Well, first of all, not a lot of pathologists go into microbiology, which my search path mentors initially were kind of leery about because they thought, well, do you really want to go into this area? You're just going to, one of them said, sit in a basement and look at gram stains. And I was like, well, that's not exactly what we, but they changed their mind when they realized that if you go into an area that's maybe underrepresented, well, kudos to you, because that just means that you're going to be highly sought after and that you're going to have tons of job opportunities because people want pathology trained microbiologists and there aren't a lot of them. So don't ever let anyone talk you out of going into a specialty because it's not the popular route. In fact, it's probably a better route in that way, as long as it's what you love. But the other thing that I've really been able to do to differentiate myself is I sign out infectious disease pathology cases. So, infectious disease pathology is a branch of anatomic pathology, just like cardiovascular pathology, breast pathology, GI pathology. It's when you see infectious organisms in histopathologic or cytopathologic preparations. And most surgical pathologists, cytopathologists, don't really like infections. They kind of get scared by them, or they don't necessarily know, like, how do I tell this yeast apart from that yeast? And so we've actually built up a really robust reference practice. So there's the three of us that are APCP trained with medical microbiology boards, and it's a specialty consult service. It's not high volume, but we get anywhere from 5 to 10 cases a day. Most come from our surgical pathology colleagues here at Mayo, but some get sent in from the outside, and we'll take directed consults. So that's something a pathologist can do that an infectious disease trained person probably can't.
Oh wow, yeah, that's great. Yeah, sure. Go on, go ahead, Casey.
I love to say, no, this is me. I actually have one more supplementary question because
Yeah.
I'm loving this conversation. I just got to ask, with medical microbiology, Dr. Pritt, do you have a favorite bug that you just love learning about or just love signing out and seeing?
Well, I mean, I have favorite organisms in that I like scientifically that I think are cool. Like there's some really kind of creepy critters that you can get from eating fish and stuff, but we won't go into those because I don't want to, discourage you all from ever eating fish again. But things I like to see in tissue, fungi are usually really beautiful in tissue. We actually see a good amount of coccidioides because Mayo Clinic, Arizona, sometimes will send us cases, and we have people that go there and overwinter, so-called snowbirds that want to get away from Minnesota's winter. So some of the fungi like coccidioides can be really gorgeous in tissue. Protothecosis, like prototheca, which is actually an alga and not a fungus. They look really cool in tissue. Rhinosphrydiosis, that might be my most favorite actually, because that's just a cool looking organism.
Oh yeah, yeah. It's also a heavily a board favorite if
Yes,
anyone is listening.
because it's so unique looking,
Yeah.
right?
All right. That's great. Thank you very much, Dr. Pritt. That's our show for today, folks. You can find Dr. Pritt on Twitter. Her Twitter handle is at parasitegal. She also has a wonderful website. It's parasitewonders.blogspot.com. Thank you very much for listening to us. If you like the show, please like and subscribe to our channels on YouTube, Apple, and Podbean. We will be back with another episode soon. Thank you.